Hello, parents. Welcome to our guide on managing fever in babies. Few things are more unsettling than finding your precious little one flushed and warm, their tiny body battling a fever. It's a moment that can fill any parent with anxiety and concern. You might find yourself wondering what's causing the fever and how serious it might be. It's perfectly natural to feel a surge of worry, wondering what's wrong and how best to help. But take a deep breath and know that you're not alone in this. Rest assured, fever is a common occurrence in infancy and in most cases is a sign that their immune system is working hard to fight off an infection. It's their body's natural defense mechanism. Remember, you are not alone in this journey. Many parents have faced the same challenges and have come through it stronger and more knowledgeable. With a little knowledge and a lot of love, you can navigate the choppy waters of childhood fevers and provide your baby with the comfort and care they need to recover quickly. Your calm and reassuring presence can make a world of difference. This guide will equip you with the information you need to confidently address your baby's fever, from understanding its causes and accurately measuring their temperature to recognizing warning signs that may require medical attention, and accurately measuring their temperature to recognizing warning signs that may require medical attention and providing effective home care. With the right approach, you can ensure your baby feels better soon and continues to thrive. A fever, simply put, is a temporary increase in your baby's body temperature above their normal range. This rise in temperature is a natural response and is often one of the first signs that something is amiss in their tiny bodies. It's not an illness in itself but rather a symptom, often indicating that their body is fighting off an infection. This could be due to a variety of reasons, such as a viral or bacterial infection, or even after vaccinations. Think of it as their internal defense system kicking into high gear. The immune system is like an army, and the fever is one of its most effective weapons. When a virus or bacteria enters your baby's system, their body releases chemicals that raise their temperature, creating an environment that is less hospitable to these invaders. This process helps to slow down the growth and spread of the pathogens. While a fever might make your baby uncomfortable, it's generally a positive sign that their immune system is doing its job. It shows that their body is actively working to protect them from harm. However, it's crucial to monitor their temperature closely and be aware of any accompanying symptoms. If the fever is very high or persistent, or if your baby seems unusually irritable or lethargic, it's important to seek medical advice promptly. Knowing how to take your baby's temperature accurately is essential for determining the severity of their fever and guiding your course of action. There are several methods available, each with its pros and cons. For infants and young babies, rectal temperature measurement is generally considered the most accurate. Gently insert a digital rectal thermometer, lubricated with petroleum jelly, about ½ an inch into their rectum. For older babies and toddlers, you can use a digital axillary or armpit thermometer, ensuring good contact with the skin. Remember to always use a clean thermometer and wash your hands thoroughly before and after taking their temperature. Section 4. When to worry. Recognizing signs of serious illness. While most fevers are harmless and resolve independently with proper care, some instances warrant immediate medical attention. It's important to understand that a fever is often the body's natural response to fighting off infections. However, there are specific scenarios where a fever could be a sign of something more serious. It's crucial to be vigilant and recognize the warning signs that indicate a potentially serious condition. Early detection and prompt medical intervention can make a significant difference in the outcome. If your baby is younger than 3 months old and has a rectal temperature of 100.4 degrees Fahrenheit or 38 degrees Celsius, contact your pediatrician immediately. This age group is particularly vulnerable, and even a slight fever can be indicative of a serious infection. For babies older than 3 months, seek medical advice if their fever persists for more than 3 days, reaches 104 degrees Fahrenheit or 40 degrees Celsius, or is accompanied by other concerning symptoms. These symptoms can provide critical clues about the underlying cause of the fever. These symptoms might include persistent crying, lethargy, difficulty breathing, a stiff neck, a rash, seizures, or any other unusual behavior. Each of these signs can point to different serious conditions that require immediate medical attention. Trust your instincts. If you're ever concerned about your baby's well-being, don't hesitate to contact your pediatrician. It's always better to be cautious and seek professional advice than to overlook a potentially serious issue. Section 5. Home Care Heroes. Comforting your little one. While you await your pediatrician's guidance or as your baby recovers, there are several things you can do at home to help manage their fever and keep them comfortable. First and foremost, ensure they stay hydrated by offering them plenty of fluids like breast milk, formula, or water. Dress them in light clothing and keep their environment cool and comfortable. Over-the-counter fever reducers such as acetaminophen or ibuprofen can help bring down their temperature and ease discomfort. However, it's crucial to consult your pediatrician before administering any medication to your baby, ensuring you use the correct dosage based on their weight and age. Section 6. A doctor's guidance, your partner in health. Navigating the world of childhood illnesses can feel daunting, but remember that you're not alone. Your pediatrician is your trusted partner in ensuring your baby's health and well-being. They can assess your baby's condition, determine the underlying cause of their fever, and advise you on the best course of action. Regular checkups and open communication with your pediatrician can help you stay informed and empowered to make the best decisions for your little one's health. Remember, when it comes to your baby's health, it's always better to err on the side of caution and seek professional medical guidance.